Many of you must have heard your dentist saying that you have a root decay. So today we are going to have a discussion on root decay. To begin with, firstly, let's see how does tooth look like. The tooth is made up of the crown part. Crown part is the top part which is visible in your mouth, and the root part. Root part isn't visible to you as it is covered by the gums. So here in this diagram I'm going to show you what the root part is. So this is the root part. This leg-like structure, this is the root part, and it is covered by the gums. Now the top part is the crown part. Crown is made up of 3 layers. The outermost layer is enamel, the strongest layer. Second layer is dentine. It is softer than enamel, and the innermost layer is pulp, which contains nerves and blood vessels. Here I have drawn one more diagram. So in the first diagram we can see the crown part. So this is the crown part, and this red area, this is the gum which is covering your teeth. In the second diagram, here we can see that the gum level has gone down than the first diagram, and this brown portion is the decay on the root. Now the gum covers the root surface, but in the second diagram the gum level has gone down, exposing root surface, and this brown portion is the decay which has happened on the root. Now tooth decay affects people of all ages. Root decay is the tooth decay which happens on the surface of the root, and it mostly happens in older people. Now in many countries people are living longer life and they keep their natural teeth for longer. As a result, root decay has been common mostly in older adults. As people age, their gums may recede and the root surface of the teeth become exposed, making them more prone to root decay. So what root decay is and how does it happen? So as I mentioned you before, root decay is the decay which happens on the root of the tooth. Root decay occurs when the gums start to shrink, means they recede away from the root. Root is usually protected by the gum, but once this protection is gone, once the gums recede, root will be vulnerable. As the root surface does not have a hard protective layer, like the crown part, it has enamel, but the root surface doesn't have such layer. And once the root is exposed, the unprotected root surface are very vulnerable to decay. And root decay spread very fast than the tooth decay itself. Now the major cause of root decay is plaque. Plaque is a soft sticky layer which forms every time we eat food. Plaque contain food debris and bacteria. So whenever we are eating food or sugars, the sugar in the diet causes decay as it produces acid. Now plaque has a tendency to build up along the gum line, and if it is not removed, it can cause decay. Many factors can contribute to gum recession and eventually root decay. First one is the old age. Second is poor oral hygiene, not brushing teeth at least twice a day with the fluoride toothpaste and not flossing daily. Second is brushing teeth too hard. If you brush your teeth too hard, it can damage your gums and gums start to shrink away from the teeth. If you're having gum disease, then also gum starts to pull away from the teeth. crooked teeth. The crooked teeth are really hard to clean and the plaque forms there, causing root decay. Smoking. Smoking is a greatest risk factor for your gums and teeth. Smoking reduces body immunity to fight against infection. Not only that, it reduces the blood supply to the gums, making the gum more prone to gum diseases. And the other one is medication that causes dry mouth. The saliva is very important as it neutralizes the acid produced by bacteria and prevent any root or tooth decay. But if the patient has a dry mouth because of medical conditions or medications he is taking, the protective effect of saliva is gone. Hence, the patient is more prone to gum disease and tooth decay, root decay as well. Now, how to prevent root decay? As root decay is caused by bacteria acting on sugars in the diet, it is very important to keep your teeth clean. So let's begin with the fluoridated toothpaste and fluoridated water. If you do not have fluoridated water in your area, you can talk to your dentist and he can prescribe you high concentration fluoride toothpaste and fluoride mouthwash as well. Fluoride is really beneficial to your teeth. It makes your teeth strong. Also helps with the sensitivity. So use fluoride, drink fluoridated tap water, and the dentist can apply high concentration fluoride, which is fluoride varnish, to your teeth at least twice or thrice a year, depending on the severity of condition. And regular toothbrushing with the fluoridated toothbrush. To my patients who are vulnerable to root decay and have root decay in their teeth, I prescribe Nutrafluor. It's 5000 parts per million, has very high concentration of fluoride. Now, the correct brushing technique. I have seen many patients using incorrect brushing technique, which has led to their gums shrinking away from the teeth, hence making them more prone to root decay. So always apply very gentle pressure, very gentle pressure, and use a soft toothbrush. Place your toothbrush at a 45-degree angle towards your gum, because this is the area, the junction between gum and the teeth. This is the main area where plaque forms. And a healthy diet with reduced amount of sugar and reduced frequency of sugar is really important. So if you have decay in your mouth, tooth decay or root decay, please see your dentist. Thank you very much.